Dereta, dereta, dereta. Stop, stop, stop. Okay, okay. Hop, 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 hop. No le mueva. Asparagus.
Hey guys, what's up? This is Stephanie and welcome back to my channel. So I just finished my first semester of clinical rotations. Yes, so I just finished my first semester of clinical rotations, and in this video I wanted to discuss my clinical rotations, so which 3 clinical rotations I had my first semester, also which one was my favorite, which one was my least favorite, and which one was the hardest. Now in the future I'm going to make videos in regards to each clinical rotation, how I studied for each rotation, and what I recommend for those of you who are in didactic year and are about to start clinical year, or for those of you who are just interested in PA school in general or are applying to PA school. So let's get into it. So my first 3 clinical rotations for the semester were, my first one was emergency medicine, so it was ER. My second one was OB-GYN. And my third one was surgery, so I just finished my surgery rotation. How long is each rotation? So each rotation is about 5 weeks. Now that's just per my school. I know some other programs, the clinical rotations can be up to 6 weeks, but my program has 5 weeks per clinical rotation. So it was 5 weeks for each rotation. You usually started, for example, on December 12th and ended January 12th, so it was exactly a month. Usually you would also have exams in between, so we have 2 exams for each clinical rotation. We have our EOR, which is our end of rotation exam, and that's on the last day of your clinical rotation. So of course that last day you do not go to clinic because you have your exam. So I would just tell my preceptor, which is the individual that I am shadowing or I'm working with, whether it was a PA, a nurse practitioner, or a doctor, I would tell them that I have an exam on this day, on the last day. So my last day would be, for example, Thursday if my EOR was on Friday, so you would take the entire day off. And also another exam that we had was an OSCE. So an OSCE is basically also an exam, but it's more like a patient encounter exam. So you'll have a fake patient, usually someone that the school acquires, whether it's a student from the didactic year or whether it's a student that's already graduated, or pre-PA students, or just any student in general, or anybody who volunteers. They act like they are a patient and they're a simulated patient, and you're required to go into the door. You knock on the door and they give you a chief complaint. They'll give you the vital signs of the patient, the name of the patient, the date of birth of the patient, and you have to calculate the date of birth of the patient, and you have to knock on the door, and depending on the chief complaint, you're going to ask certain questions. You're going to ask, for example, certain HPI, for example, the onset, the location of the pain, the duration, the character of the pain, whether it's stabbing or aggravating, and also the past medical history and family medical history, social history if they drink or smoke, and also review systems. If it's something, for example, like abdominal pain, make sure you're asking if they have any blood in their stool, even like blood in their urine, etc. So you're grading on how you ask these questions and whether you ask every single question on their list. So you'll have a staff member, usually a professor, that will be in the room with you. And while you're interviewing the patient and asking the patient these questions, they're just checking off whether you asked the correct questions or not. And then once you're done obtaining the HPI and past medical history, then you move on to the physical exam. So you do a physical examination. We're required to do 3. So I usually do cardiovascular, so I'll do a quick cardiovascular exam. I'll do a quick pulmonary exam, for example, if it was abdominal, and then I'll do a full abdominal exam. So you're also tested to see whether you do the appropriate exam. So for example, if a patient was coming in for breast pain, then I would do a pulmonary exam, a cardiac exam, and then you would do the breast exam. So you are tested to see that you do the correct exams that are required for the chief complaint, and then also whether you did them correctly. So once you're done doing the past medical history, the HPI, and you did the physical exam, then you're required to go to the professor, and you're required to gather all that information. try to make it as short and precise as you can, and then explain the professor what is going on. So for example, you would say, I have a 54-year-old female that's complaining of abdominal pain. This started 2 days ago. She said it's worse whenever she reclines. She says it's better whenever she stands up. She tried taking ibuprofen for it. It says it hasn't gotten better. She has a past medical history of diverticulitis, family medical history of gastric cancer, colon cancer, etc. So basically you have to put everything into a short, I would say like 2 minutes or even 3 minutes explanation, so you can explain your professor. Also in that, you have to include your physical examination. So for example, pulmonary and cardiac exam were normal. I did an abdominal exam and did notice that she had some left lower quadrant pain and tenderness upon palpation, depalpation, etc. And then once you're done doing that, you're going to tell your preceptor, well, what I want to do for the patient is, you're basically going to work up the patient. You're going to say, I want to do a CBC, so a cell blood count, complete cell blood count. I want to do ultrasound of the left lower quadrant, or a CT scan, or an x-ray, etc. So whatever you want to do, you tell your preceptor. And then your preceptor will tell you, okay, well, the CBC came back normal, the ultrasound came back abnormal or normal. For example, if it was gallstones, say they did an ultrasound of the right upper quadrant, she would tell you, we found gallstones in the gallbladder. And so depending on what they tell you, then that's how you're going to say, oh, I know what it is. So for example, if it was gallstones, I would say, okay, thank you. So now you're going to go to the patient and you're going to tell them, okay, so I performed an abdominal exam. I noticed that you had some right upper quadrant tenderness, and I ordered a CBC and an ultrasound. The ultrasound showed that you did have some gallstones in your gallbladder. So what we're gonna do is that I'm gonna refer you to a surgeon. I'm gonna give you some pain medication for now, etc. So basically, you go and you talk to the patient and you tell them what you're gonna do with them, etc. And also emphasize on patient education. So in this case, if the diagnosis was cholecystitis, which are gallstones in the gallbladder, you would tell them that you're going to refer them to the surgeon. This is usually due to sometimes fatty foods. If it's just gallstones in general and they don't have cholecystitis, which is inflammation of the gallbladder, then you can tell them that surgery is usually elective. They don't have to get the gallbladder removed, but if they start eating proper foods, good foods, avoid fatty foods, and this can prevent the pain. So emphasis on patient education also. So once you're done doing that, then they ask the fake patient to walk out, and the professor will sit with you and they'll go over your grade, and they'll tell you what you missed, whether your physical examination lacks something, etc. Whether you're usually they don't dock you off if your diagnosis is incorrect, but most of the time I've gotten correct diagnoses, but I know some of my classmates that did not diagnose the patient correctly, they weren't docked off. So, and it's usually very, very common complaints like that we would get. And usually the complaint that you get is based on the rotation. So for example, in surgery, since our EOR is about 50% GI, gastrointestinal, they try to gear towards GI complaints. So for example, for appendicitis or cholecystitis or diverticulitis, diverticulosis, etc. Versus ER, we had a complaint that was bone related. So it was, for example, wrist fractures, knee pain, etc. And then for our OB-GYN, it was more OB or GYN related, right? So it was pelvic inflammatory disease, breast pain, mastitis, etc. So they're usually geared towards a rotation. And usually the professor will kind of give you a heads up like, hey, these are the possible complaints that can be on there. So I make sure that we practice for those. So that's basically what your OSCE is. It's usually in the middle of the month or towards the end of the month, but you usually have 2 exams. Now for my program, they're each worth 40%. So 40% for the EOR, 40% for the OSCE. And then you have 10% also on your preceptor evaluation. So the individual that you are shadowing or the doctor that you are working with will evaluate you on how you performed, whether you were there on time, whether you were absent all the time, whether you were good with patients, etc. So they fill out this questionnaire, and at the end you get a grade, and that's 10% of your overall grade. And the other 10% is that we have quizzes every week, and then we also have like a vlog that we have to write about. So a blog basically about what we saw in clinic, what we thought was interesting, or something that while we were studying for our end of rotation exam, we thought was interesting. Now, the end of rotation exam is also geared towards each rotation. So it'll have diseases that are common for each rotation. And the EORs are not written by my program, it's actually written by the PAEA. So it's actually at a national level that every PA program gets these exams. So you can actually go online and go PAEA and then Google EOR, and it'll give you every single rotation, and it'll give you the topic list for every single rotation. So that's what I used to study. I would just go on there, and then it would tell you, for example, appendicitis, diverticulitis. Sometimes you would have very vague complaints like abdominal pain or nausea, and those would just be so annoying because there's so many things that can cause nausea and there's so many things that can cause abdominal pain. But I will discuss the EOR in a different video, but I just wanted to give you basically a heads up of how my first semester was for PA school of clinical year. And honestly, I think I started with the hardest ones, which were emergency medicine and OB-GYN and surgery. Definitely out of the three, my favorite one was OB-GYN. And it's interesting because I was not really looking forward to that rotation at all. OB-GYN never really brought my attention during didactic year. I didn't do very well also on the exam either, so it didn't really catch my attention. I wasn't really interested in it at all. And this serves to tell you that you have to be open-minded, guys. Like, be open-minded, because if you're closed-minded, then you're not going to enjoy your rotation. So I really wasn't looking forward to it. And then as the days progressed during the rotation, I told myself, you know what, I can really see myself doing this, working with women, working with pregnant women, and etc. I really, really enjoyed that rotation. But also I had a really good preceptor. My preceptor was amazing. And I think that's also something that is really important when it comes to your rotations, for you to enjoy them, whether your preceptor is good or not with you. So in this case, my preceptor for OB-GYN was amazing. Out of the three, which one was the hardest? I think, so in regards to exam-wise, I think emergency medicine was the hardest for me. I actually didn't do well at all on the exam, and I was really, really surprised because I'm trying to get into a doctorate program, or I'm trying to do a residency or a fellowship once I graduate. So in order to do that, you have to have a very high GPA. So I'm very strict with my grades. I really try to get A's, good grades in general. And I was really upset with myself because for my first exam, I didn't do well at all for the emergency medicine. I really struggled with both the OSCE part and the end of rotation exam. Now, it was my first exam during clinical year, so I didn't know what to expect at all. They had told us, but I didn't know how to expect at all. And I had to change my studying habits a lot more than how I did it during the didactic year. So I finally learned after my first EOR and OSCE, and thankfully for my second and third, which was OB-GYN and surgery, I did a lot better. So exam-wise and material-wise, I think that emergency medicine was the hardest. Now, in regards to clinic-wise, I think surgery was the hardest for me. The reason why were the hours, and then on top of that, the EOR was really, really hard. The national average for the EOR nationwide for all the PA programs is a 77. And so I was really nervous because I needed to get higher than a 77 to get the grade I wanted in my surgery rotation. And so on top of that, for my program, I think the highest grade ever was like an 81 for the EOR. So that really made me even more nervous and made me have more pressure. And then during your surgery rotation, you can't really study as much as you want to because your clinic days are so long. So for example, my doctor, I would go in Monday through Friday, and then my doctor had surgeries on Mondays, Fridays, and Thursdays. Mondays and Fridays were like the longest days. I would get there at 6 a.m. Sometimes wouldn't get off till 10, 11, or sometimes even midnight, and I was there all day. There would be times where I didn't have time to eat, so I remember I would starve. I learned afterwards to start taking snacks with me, but I remember the first few weeks I didn't know what was going on. And yeah, so Mondays and Fridays were the longest days, and then Tuesdays and Wednesdays he had clinic, and I would go in like around 7 or 7:30, be there around till 6, and I would go home. And sometimes I was just so exhausted I couldn't study, and if I was studying it, I felt like I wasn't retaining it, and I was just so exhausted because of the previous day also, because if I had surgery till 10 or 11, I would come home, sleep, wake up the next morning around 6:30, and then repeat the day. So I was already trying to catch up from my sleep. And then Wednesday was also clinic around 7 a.m. also to around 6 p.m. or 5 p.m. depending on what time he finished seeing all his patients. And then Thursday he had clinic in the morning, and then he had surgeries in the afternoon. So sometimes I would also get out late, like at 9, 10, or 11, to do the same thing the next day, Friday's surgeries. And it was really, the schedule was just really long, and that's why it was really tiring. So clinic wise, I would say surgery was also the hardest one. Material wise, I think ER was the hardest one. My favorite was OB-GYN, although I still want to do ER. I didn't have a very good clinical experience during my ER, so I hope I can remediate that next year during my capstone, which is where I have 4 months and I get to do a rotation that I enjoy. So I'm still debating on whether I want to do ER or OB-GYN. So we'll see, and then I will let you guys know. But yeah, that's how my first clinical semester went. So my first 3 rotations, which one was my favorite, and basically how the exams were in comparison to didactic year. So I hope you guys enjoyed the video. If you guys have any questions for me, please comment below. I'm trying to make a video where I can answer questions from you guys, like a frequently asked questions, whether it's about my personal life, whether it's about PA school, etc., and just answer all these questions. I get a lot of questions sometimes in the comments, and it'd be awesome if you guys just had a bunch of questions and I can make a video just answering all these questions. Alright guys, well, thanks for watching my videos. As always, if you guys have a question, email me or make sure you comment below. I'm sorry if I don't contact you as soon as I can. Like I said, I just finished my surgery rotation, and that rotation was just so busy. I rarely had time for anything, so sometimes I got backlogged on my emails or on my Instagram account. I got really backlogged. So, but I will respond to you guys as soon as I can, okay? Thank you for watching my videos, and I'll talk to you guys later. Bye.